Hey everyone, welcome back to the Hair Loss Show. It is my incredible honor to welcome to this series of chatting with experts, Dr. Alan Bauman from Boca Raton, Florida. Alan is an absolute titan in the field. He's been in the field of hair restoration and hair restoration surgery for over 20 years. He's been through the gamut of all the trends that are associated in the field, and he's got a phenomenal practice, a really holistic practice in Boca Raton that really takes their patients through that journey. And hopefully we tease some of those out in this conversation. Alan's really good at incorporating other elements into his practice. He focuses on nutritional side of things. He's got a trichology department. He's got an anti-aging department in his practice. And of course, he's an absolute master when it comes to hair restoration surgery. This has been a really interesting conversation. I hope you enjoy it as much as I did, because it just opened my eyes to lots of different things. So without further ado, I'd like to welcome Dr. Alan Bauman.
Welcome to the Hair Loss Show, where Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Great. Listen, everyone, this is Dr. Alan Bauman from Boca Raton, Florida. Alan, this has taken us quite a while to get to this point of setting this up. But listen, I'm so grateful for you to give us this time. You're obviously an absolute legend. So, and it's 7:30 in the morning. So, thank you very much for taking the time to have a chat. I'm super excited.
Well, I'm super excited to be here with you, Vikram. I know it's been a while to get on the schedule, but I'm excited to be here, and congrats on all that you're doing for the industry, educating all those patients out there. So good job.
Well, thanks. Listen, so no, I've wanted to touch base with you and sit down, and we had a conversation when we met in person back in Panama, and I really wanted to sort of follow it up and just sort of pick your brain about quite a few things, because obviously you've got a massive center in Boca, but more than that, you've been in the industry for a long time. You've seen the changes, you've seen the fads, you've seen everything that's come about. And what I really admire about you, and why I'm super excited about having this conversation, is that you've always been open to everything, as in everything that's new, that you've given it its due attention. You've looked into it. You've incorporated a variety of things into your practice as well, which I really admire and love. But you've done it in a very, from what I can see, you've done it in a very thoughtful manner. You've looked into it. You've weighed up the pros and cons. I mean, first of all, were you always like that? Were you, because you can find a lot of people that go, oh, you know what, I love hair, and I love doing hair transplant, and I know about finasteride, and I know about minoxidil. Let's go.
Yeah. I think I've always been kind of a tinkerer, by nature, trying to fix things, whether it was a go-kart or computer or whatever, programming and such. So I've always kind of had that inclination to try to, make it better, whatever, I'm never satisfied with the status quo, if you will. And even today, before we got on the call, I was noodling around, talking with OpenAI, ChatGPT, about some different things that I was thinking about for next year and how to implement them into the practice. So I guess I've always thought about it that way. And I don't know if you know this, but my dad is a dentist, and he's still practicing well over 50 years in New Jersey, here in the United States. And so he always taught me from the time that I was a toddler about the prevention aspect of dentistry. And so I think it's always been kind of ingrained in my thought process that even when I started to learn about hair transplant surgery, I was always looking for ways to help people protect the hair that they have, so that they wouldn't need so many hair transplants. And that was always a big part of the practice. Even as we just talked about before we got on the call, finasteride back in 1998, before it was even FDA approved, I was thinking about that as a preventative strategy to help patients get better outcomes. So I think
Yeah.
it's a combination of like being a tinkerer, whether it be like, trying to improve whatever it may be for the patient or for the practice. And then also taking a very patient-centered approach, like wondering, is this a good idea for me if I was the patient, or if it was my brother or my uncle or my dad, who are, you know, many of whom are our patients in the practice, by the way. But we want to try to figure out, well, what's the best options for them? Like if I was in their shoes, what would I want the physician or guidance be? And so that's kind of the simple answer. Like I always think about, well, would this be good for patients? And then if the
Yeah.
filter, that use that as a simple filter and kind of a true north to point to.
And I also think it lends itself to the concept that not no two patients are the same. Everyone is on their own journey. There's no unifying treatment option that fits everyone. It's not trying to fit a square peg into every round hole, so to speak. So, but I like the concept of a toolbox, so to speak. We've got a
Oh, yeah.
toolbox of a variety of different things that we can use for our patients, right? And like you say, noodling around, tinkering around. What will this work better for this individual? Will it fit in with their lifestyle as well? Not just pharmacologically will it work?
Oh,
I'm
yeah,
actually
absolutely. I mean, and to your point, I mean, even when I do presentations to those who are entering into the field in the very, very early stages, I mean, there's literally a slide in my presentation. It shows the toolbox. I mean, that's,
right.
what it is. I mean, the toolbox is there, and then the algorithm, how we take a patient through their lifestyle and risk factors, their genetics, and then look at what their goals are. What are really their issues? I mean, you have no idea how many times I hear patients that come in from other clinics who have had a consultation, and the first thing the surgeon did was draw a line on their head.
Yes.
I
Yeah.
mean, that's the quickest way to make somebody run for the door. And then, and just to, I mean, I try to explain to young surgeons and those who are entering into the field, why don't you spend a little bit of time talking to that patient first?
Absolutely.
Don't just rush and jump on their head like with a crayon and get I mean,
Yes.
that's like not the right. I would never start with that. I mean, in fact, that's usually the last thing that we're doing on the day of the procedure after many hours of conversation.
No, absolutely. Um, I mean, yeah, we see that all the time, isn't it? It is so many times, and it does my head. And you meet people who have gone to places who have, and unfortunately, you know, when you say people should run to the door, a lot of people don't. They get sort of sucked into that whole notion that that is the way forward.
Mm,
And I think it's important for in scenarios like this, or on platforms like this, that we are able to at least try and sort of get the word out that actually no, it needs to be in a more structured manner. Like you said, the algorithm and working through that for the individual. But Alan, let me ask you this. I mean, you've gone through this whole timeline, and you've seen things come. And like I said, you looked at facts. Right now, I guess it's a two-sided question. What are you most excited about, and or what are you what's most successful for you? And let's take finasteride and minoxidil, because those are two really well-known therapies. Let's park those aside. Okay, we can always circle back to that but I
sure.
think it's also good to know what else is out there, how you're using it, because I know for a fact you've got a huge amount in your toolbox, and I'm dying to pick your brain as to what works for you. What's really getting your sort of juices going right? I'm really
Sure,
excited to see
sure.
how this is coming along.
So, just as a surgeon, I feel like I've been pretty blessed, been exposed through a lot of my colleagues, close friends who are in the world of orthopedics and other areas of surgery regarding regenerative medicine. And it's been a passion of mine for many, many years. I remember, I think it was in 2010 or so, I was amongst one of the first to go through a certification process, a training process that the American Academy of Anti-Aging had, a stem cell fellowship. And not only did I go through that certification, but I also ended up being a faculty member on that, actually demonstrating what we were doing to help regenerate hair.
Yeah.
using the body's own growth factors and cytokines and chemical messages, if you will, leveraging the body's repair process to improve hair. And so, PRP, platelet-rich plasma, sometimes gets a bad rap today, mainly because it's been so literally watered down by
Yeah.
many practitioners. They think they can just spin a test tube and get a PRP treatment that's going to be effective for the scalp. That's obviously not true. And
Yes.
you only have to go online to do a quick survey, and you can see that for many people it didn't work.
Yeah.
What we've determined in that world of PRP, platelet-rich plasma, if we just focus on that for a moment, is that there's a dosing strategy, just like with finasteride or minoxidil or laser light therapy, which are all very well proven treatments today. Regenerative medicine requires a dosing strategy. That means how many platelets, how often, how is it applied, right? What is the preparation protocol? And after doing things like PRP and stem cell therapy for literally, I would say 16 to 18 years on a consistent basis, maybe 13,000 PRP treatments at this point, we've got a well-wrought process. We know exactly what we need to do to try to get the best result for every patient. Now, that having been said, an 80-year-old person with PRP is not going to do the same as a 25-year-old person. And that's the case whether you're talking about a bum knee or a depleted scalp. But
Yeah.
the bottom line is that the dosing of platelets is critical. And so that's like a key factor that I discovered years ago by employing a technology that allows us to measure how many platelets are literally in the blood concentration of the patient when they come in,
Yeah.
spin the PRP, and then test it with that same device to determine the platelet concentration before it was applied into the scalp. And then guess what? Measure as you go along on a regular basis what the effects were. And so if you're continually measuring patients and continually treating and continually measuring the PRP concentration, you're going to figure out what works. And that's kind of what we've done. So platelet-rich plasma and cell therapy has been a big part of the practice, but there's other ways. I mean, a lot of patients maybe don't want to spend a lunch break getting local anesthetic, even if it's with a comfortable nitrous oxide process, laughing gas process that we use. And so the latest and greatest technology for that is called sonophoresis. And
Yeah.
that's what I lectured on at
And you're going to
MCAS last year.
World Congress as well, isn't it?
Yeah, I'll be speaking about that at the ISHRS coming up in New Delhi this fall. They've accepted my presentation, my abstract on my pilot study for sonophoresis and hair regrowth using ultrasonic sound waves to break up the stratum corneum, which is the moisture barrier in the skin, increasing its permeability, and then pushing powerful growth factors and peptides right through that skin. So those two technologies, ultrasound, growth factors and peptides, and that's what the sonophoresis TED treatment does. So that's called TED, transepidermal delivery.
And you've look, I'm really looking forward to it. I know that's coming up on the schedule. So I'm looking forward to that. But as a quick sort of insight, what is your sort of 5-second summary? Can you give us a preview of what have you found? I mean, obviously you're excited about that. You've incorporated that into your practice full time,
Yeah.
as a standard.
Yeah, we're 2 years down the road now already. I was one of the first to be able to launch that device in North America. I don't even think it's available yet in Europe or Asia. At least it wasn't at the beginning of this year, back in February when I was out there in Paris presenting on the topic. Alma is the company that basically took that technology from Israel and moved it into into North America. Sonophoresis has been around a long time, but combining that with powerful hair growth peptides and growth factors that's where the new technology is. But I've been extremely impressed with that technology. There are some downsides. So geographically, if you're a patient of mine and you can't come in once a month, then you're not going to be a great candidate for a TED treatment, unfortunately. And so our PRP works for about 10 to 14 months. So it's a once a year bit of business typically, whereas TED requires this series of therapies. But the good news is that we're seeing great results. Now, it's not a new hair follicle. And just like other non-invasive treatments, whether it's a topical medication, oral medication, laser light therapy, platelet-rich plasma, we're making the weaker hair follicles stronger. We're going to make them produce a longer hair, hopefully a thicker hair, as well as maybe even a darker hair. And those are the things that we're seeing with TED. And probably one of the most amazing things is that it's a great treatment for people who are undergoing a shedding phase. So it's really, really good for shedding,
Yeah.
and it's a very, very nice stopgap for those who are experiencing this miniaturization. That's the hallmark of male and female pattern hair loss. So I have to say that I think that the women do a little bit better with TED than the men. And I think it's just a function of how many hairs they have in the zones that we're treating. Because, that's what we're activating, right? We're activating the hair follicles. And so if you have a big bald spot, maybe
No.
too late for TED. You might need a hair transplant in the temple areas or in the crown, but the other hair can respond very well. And that's what we're seeing both in our early male hair loss patients and female hair loss patients. That TED is working great.
Cool. Yeah, sorry, I digressed you on the side with Ted, but you were going to say you talked about PRP. What other things are, what's probably your next thing that you're also really sort of really optimistic about that's coming
Well,
or you're
I
incorporating into
yeah,
practice?
I mean, I think many of my patients already know that I have a very keen interest in scalp health, and I have
Yes.
an entire department, a certified
Mm.
trichologist
Yeah.
and her assistant who take care of our scalp health issues. I think it's critical to optimize the health of the scalp before you transplant, and then also to care for the scalp in a very specific way while that healing process is going on. And I've been able to accelerate growth and improve recoveries and our outcomes. Even just the quality of the hair seems to be a lot better when we're focusing on the health of the scalp. And so, for many years, like for example, I've gone to conferences for 25 years in the world of hair loss and hair transplants, and surgeons often say, "Oh, there's this X factor that degrades the quality of the hair or makes some follicles maybe not grow during a transplant process." And maybe, and I don't know for sure, but maybe the scalp health and inflammatory processes that are going on at the level of the scalp might be one of those X factors that we've just kind of overlooked over the past 2 decades. So I'm pretty excited about that, to continue to provide that level of care. It's amazing when you ask patients and look at them under the microscope, how many people have dysregulation at their scalp. I mean, probably 50% of all the patients through the door have either are having some issues with their scalp or have had some kind of issue with their scalp in the past.
And I remember when we met last, you were telling me that you've got a huge amount of data because we'd just come through COVID, and you were seeing a lot of people in that sort of post-COVID phase of shedding, and a lot of sort of post-inflammatory sort of response, and what's been your follow-up with that, or what has been your sort of take on that coming through? Because I mean we're seeing that a lot as well.
Yeah. I
A
mean,
lot of people coming
it's,
through the door with
I,
that.
I mean, I would say like just a general trend over the past 25 years is that we're seeing hair loss in younger patients, and we're seeing it more aggressive. And unfortunately, with COVID, and I just say with COVID, I mean like the whole pandemic era, all of that is accelerated, unfortunately, for those out there with hair loss or who are prone to it. So whether you were just simply locked down, shut away, not exercising, not eating right, isolated from your family, or you actually had the disease, right? You contracted COVID, as most of us did,
Yeah,
although I never tested positive, but most of my patients have,
yeah.
or vaccinated. A lot of this can really trigger a huge amount of hair loss. And so I have patients in the autoimmune category who we've been treating for more than a decade in remission from alopecia, like alopecia areata and totalis and things like that, who were doing fine and great up to a point, and then all of a sudden, either there was an infection or a vaccination, and all of a sudden, their autoimmune system is off the rails. There's a huge amount of inflammation at the scalp. It's shutting down the hair follicles, the shedding from a cytokine storm, from a fever, or even now the resurgence of the flu, which was mysteriously gone for so many years. Like, where did the flu go during COVID? Nobody knows. But the bottom line is that it's been devastating for patients and very disheartening for those who kind of thought that they had their situation under control, and then all of a
Yeah.
sudden experience this massive shed or a rapid acceleration of hair loss. And so, I mean, there's no question in my mind that this era, this pandemic era that we've lived in, has really been devastating on people's hair. And I guess it just made me realize that the hair follicle is a very, very sensitive organ, as we
Mm.
kind of knew already. And it's not just scalp inflammation, but whole body inflammation and circulation, right? We've heard of all these problems with circulation, strokes, and things like that, and myocarditis and inflammatory processes, pericarditis, from COVID and vaccinations and so forth. And maybe that yet still has yet to be sorted out, but in my practice, there's no guesswork. I mean, we know that we've just seen too many. I mean, I've literally treated over 1,000 COVID-related hair loss patients in the past 2 years. It's been brutal.
Yes, you
But the good news, the take-home message is that when we take a more holistic approach, we can make people more resilient to these biotoxins and the stress and their poor nutrition, and get them back on path. And that's kind of led me to add functional medicine into the practice, actually, here at Bauman Medical. So I mean, that's another new venture that within the past year that we've really kind of solidified at Bauman Medical.
and that's awesome. I mean, I really like that aspect of things because I love that holistic view. And it's just that it's not about surgery. It's not about, it's and it's not just about hair, because hair is actually just another sign of what could potentially be going on in other parts of the body. And I know you've I geek out on this a lot as well. I know you're really into functional medicine, regenerative, but into biohacking as well. And you've spoken at a few of the biohacking conferences, and Dave Asprey. I mean, that's, like I said, I geek out on all of those things. But I love the way that you also, I can see you really enjoy that. I've seen your aura ring on your finger as well, and so I know you track everything. But you've also incorporated that into your practice, and you've got a functional medicine practice. You've got making sure you're big on nutrition, you're big on nutrients, and making sure that that side is taken care of, because it all needs to work for the engine to sort of purr along at its most sort of effective and optimal rate.
Absolutely. I mean, look, all it takes is for you to look at a picture book or a picture online about the anatomy of the hair follicle. You've got some blood supply, you've got nerve endings, you've got muscles there, you've got all those things. Even without going deep into the cellular mechanisms, you can just guess that all of those things are attached to the hair follicle, and there's a symbiotic relationship there. I mean, we know that hair follicles are the canary in the coal mine for so many dysregulations that could happen in the body, whether it's the stress situation. I mean, we know cortisol is going to shut down the follicle. If you have poor circulation, maybe, and they've always said this about guys with erectile dysfunction, that potentially that's the canary in the coal mine for heart disease. Well, guess what? Maybe if guys who are experiencing some thinning at the level of their scalp, could be a circulation problem as well. And doing things as simple as adding nitric oxide into your system, you know, uh, can be very, very helpful, improving circulation to the hair follicles. I mean, honestly, minoxidil, laser light, all of that improves circulation, not just
Yeah.
massage and derma rolling and microneedling and things like that. So, you're right. We take a very, very holistic approach. I'm very keen on sleep. I think that sleep has an important regulatory function, whether it comes to stress and rejuvenation and just emotional wellness, as well as athletic recovery, and obviously being able to handle, what life throws at you. You need to have
Yes.
good quality sleep. And sometimes as a surgeon, I feel like, maybe I have post-traumatic sleep disorder. I don't know from my residency. I'm not sure, but I've definitely focused more on that for
Yes.
myself and try to do that for my patients. And there's some good evidence actually in the literature about how circadian rhythm can also impact hair follicle metabolism and the metabolism of the skin. Like if you're jet lagged, you're more likely to be sunburned if you're on vacation.
Right. Okay. Okay. Makes sense. Yes. I can
So
see where
that
you go.
you're more likely to have an outbreak of psoriasis or another inflammatory process. So, tuning up your circadian rhythm, and of course, we've seen jet lag related telogen effluvium many, many years, and we just didn't, put it all together. How do we fix that?
Yes.
Patients coming back from the Far East, and I hope I don't have to deal with that going to India and back with the new conference coming up. But I think about that a lot, and if you can regulate that circadian rhythm the way that Mother Nature intended, I think you can fix a lot of things in the body.
Look, I think that's phenomenal. Not only, and I'm just sort of trying to, because I think not only do you live it, and you understand it, and you live it. You've also gone as far as, okay, I'm going to put all my patients. I'm going to give my patients the opportunity to have that as well. And you've opened your practice to be able to cater for that. And I think anyone who's and that's I need to take a leaf out of that book for me in my practice, and I need to sort of think about how to incorporate those things, because, like you said, it's easy in the day-to-day rigmarole to go, right, okay, well, I've got my day is broken up into surgery, and I've got to see these patients for consult, and I've got to understand what their problem is.
Mm-hmm.
But it's about going, right, okay, yes, we need to break it down. There are multiple layers of things that we need to get, to get the house in order, and making sure that your nutrition is in check, and all these other things that your sleep is optimized. Look, I mean, I think we left the big players out, and it's probably only sort of fair to come back, to and talk about finasteride, obviously, and minoxidil. You've used all of those for many years. Has your method of prescribing those changed? How is? I mean, I'm sure it has changed, but how's that changed over the last 20 odd years?
Sure. So, I mean, in the beginning, we had Propecia, we had Rogaine, and that was kind of the end of the story. And, but today, totally different. I mean, a lot of patients may not want to be on oral finasteride. They want to try to avoid that 2% chance of sexual side effects, which always seems much more if you do a search online, right? It seems like everybody's situation is going downhill. But, the reality is, after treating 33,000 patients, I know that it's going to be about 2% that are going to have some sexual side effects that are reversible, which is nice. I've never seen an irreversible side effect. I've never seen a persistent side effect in the practice over that length of time, over 25 years. So maybe we just haven't come across it, but I've also been using compounded versions of finasteride, not generic. I'm very nervous about generic medications. The FDA has issued warnings about generic medications in the past, and as we know, there's very little oversight and quality control. So the way I prescribe finasteride is very different than, I would say, most physicians. Most physicians will write a script and send the patient to their local pharmacy to pick up the meds. But a lot of that stuff is made overseas, and maybe, like I said, without great oversight or consistency or quality controls. And so when I work with a compounding pharmacy, I know that they're testing the quality of the product, that they're going to mix it specifically. I can also have control over what other nutritionals and nutraceuticals I want to put into the capsule. So very few of my patients in the practice are on a generic finasteride. I mean, I mean, maybe it's far fewer than 1%. And so I think that's probably one of the reasons why we have such consistently good results with finasteride and low side effects in the practice. And I just remember when finasteride went off patent, maybe it was in the late 2000s, right? And so finasteride went off patent. Everybody was super excited. Let's get it generically. It's going to save all this money. Well, guess what? Our hair measurements, right? So we're measuring everybody's hair. All of a sudden, hair measurements started to go wonky. They started to go down and down on some of these patients. I'm like, what's happening here? And so I said to them, either let's get you back on the name brand, or let's go to a quality compounder. And we vet those compounders. We visit them personally to make sure that they're on point. This is not some guy mixing up finasteride in their bathtub, down the block here. I mean, these are huge PCAB certified pharmacies that have, clean rooms and 50,000 square foot productions and things like that. So I think that's part of it. Obviously, topical finasteride is a great way to circumvent the systemic absorption that you would get orally.
You had good results with topicals?
Our topical finasteride, Formula 82F, is what I prefer. That is finasteride, minoxidil, tretinoin, and fluocinolone, plus a non-greasy base. So it's not going to be irritating to the skin. It's going to quickly absorb like that. I've used it myself. It's a great tool to avoid that systemic absorption and get the benefit of both FDA-approved medications in one solution. That's not going to leave you with a hair emergency in terms of the styling. It's going to be a quick and easy way to get that medication absorbed. I wouldn't say it's quick as a hand sanitizer, but within 3 minutes or so, it's really dry. I mean, it just absorbs beautifully.
Which is a real problem with a lot of people experiencing with certainly minoxidil with the propylene glycol. It just causes, it puts a lot of people off, doesn't it?
propylene glycol, set the topical industry back so many years of why they decided to use that. I guess it was the only thing that the pharmacist had on hand at the time. I mean,
Yeah.
it's such a nasty vehicle. It's irritating, it's greasy, it's gooey. So we avoid propylene glycol at all costs. I mean, that's like the last thing you want to be putting on your scalp, cosmetically or even medically.
Yeah.
It's a common irritant. So many people, probably 30% of people have an irritation from that. And you just have to ask your patients who have used Rogaine in the past.
Yeah. No,
And why
those.
did they stop it? They either say it messed up my hair or it irritated my skin.
Yeah.
Bingo. So 82F is what we use for that. And then, of course, oral minoxidil. Probably we should not, leave that stone unturned. Oral minoxidil, as you know, in the field of hair loss, has been around for a decade or more.
Right.
And I know that there are some great physicians in your neck of the woods who have been promoting and doing the research.
Sinclair's massive on minoxidil. He's using a sublingual minoxidil as well.
Oh, that sounds really cool. I would love to learn a little bit more about that.
I'll give you the information on that. So he's using but I mean the dosing is not comparing apples with apples. So compared to the oral version, but he's using a sublingual, and he compounds it as well. He's got a compounding pharmacy on site that makes the sublingual delivery, and he believes that he's got evidence to show that certainly the absorption, the efficacy of that is better than
through the gut.
Yeah. So
wow, and you could probably microdose it a lot easier with the sublingual category, so you don't have to worry about maybe some of the more systemic side effects that we see in our, let's just say, women over 50, could have more effects, from oral minoxidil, whether it be, headaches or dizziness or unwanted hair in other places, things like that. So yeah, well, that's super exciting. We've got to get our US based compounders working on that.
You work a lot. You very closely with your compounding pharmacy and make sure that they've got everything that you want in every specific in the formulations that you want it to have. Isn't it?
Wow.
That's.
And being sublingual, it's maybe even you just carry a little packet around with you. You could probably dose it 2 times a day. Even make it simpler.
Yeah, I think
and keep the dose. Look at the PK. Look at the pharmacokinetics, obviously, and determine what's the right dosing strategy.
Still doing it once a day, but you can. But it's a lot more customizable in terms of what the dose. And I know he's sort of proponent of going on higher dose of oral minoxidil, but I've got the info. I'll send that to you as well, and you can have a chat. But
super
listen,
exciting.
No, that's really good. But look, I think we've covered it. I mean, thinking back to, we've covered a lot. I've got to let you go. I could sit here and talk all day. You're so easy to talk to. B, you're just an absolute wealth of information. It's an absolute pleasure, and I'm truly honored that you spent the time. I love what you're doing. You're, like I said, you're a titan in the field. I mean, it's so admirable the practice that you've created, but more importantly, the journey that you take your patients through, because you've almost left no stone unturned. So, hats off to you, because when someone's able to do that, that's just that's really truly commendable. So thank you very much for your time. I really am grateful for you honoring me with your time today.
Oh, Vikram, it's great to be with you. I mean, obviously, as a surgeon, surgery is my primary thing. That's what I love to do day in and day out. That's my moment of zen. That's the state of flow for me, working on those patients and getting them a beautiful looking artistic result with their procedures day in and day out. So not just that, the macro approach, which is the holistic approach and the preventative long-term approach, but also when it comes time for the transplant, to make sure that they get the most minimally invasive, most effective, highest rate of growth, and beautiful, natural looking results that we could possibly deliver in the industry. And I think, we need more clinics to focus on those things as well. So not just the macro view, which is the holistic way of looking at the hair follicle, but also let's not lose focus on the artistry that's involved with the procedure itself and the patient experience. For God's sake, make sure they're comfortable, as well as getting an effective treatment at the same time. So,
no, look, I think that's absolutely wise words. And I think that's given us sort of topics to talk about on our next conversation. I think we'll go deeper. We'll talk more about the surgery side of things, because I think that's that really deserves a conversation. And again, we could talk about that all day long as well. But I know you, yes, you you have that, and you focus on the surgery side of things as well. And I know you do long hair transplant as well. So yeah, we've got a lot that we need to still cover. But Alan, thank you very much for your time. If anyone wants to contact you, you're baumanmedical.com. Is that correct? I'll put the link in the
Correct. Yeah.
description as well. Your handle.
So we have patients from all over the world that start their hair restoration journey with us through baumanmedical.com. So it's BAUMAN medical.com. And you can even just ask a question at the website. There's actually baumanmedical.com/ask, and you can type your question right in there if you don't want to fill out a big long form. And I'll respond through my team and get the information that you need about your hair loss journey and hair restoration journey right to you. So, today with the technology, just like this video call with you on the other side of the world, we talk to patients about their hair loss, as well as obviously bring them into the clinic from all corners of the globe. So it's very much a destination location here in South Florida, not a bad place to visit. We've got our beaches and our restaurants and our shopping, as they say, as well as amazing results in our hair restoration procedures and treatments.
Fantastic. Well, congrats on all that. Like I said, I'll put all the links in the description as well. Alan, thank you very much for your time. You've been an absolute legend, and I look forward to seeing you in a couple of months' time in Delhi as well.
Absolutely. We'll see you there.
All right. Take care. Thank you.
You got it. Thank you so much. Great to be with you.